Hi, Jim. Thank you so very much.
I can.
Uh, Hi, advocating for ourselves. I'm an MSA patient as well. Is so important, and we have many hurdles, not only with just dealing with our illness, but things that are insurance or doctors understanding what we're going through that simply don't understand the disease. So your information has been so helpful and can help guide us and navigate us through this journey. Um, let's go ahead and get started with some questions. Uh, my name is Kathy, and I'll be your moderator. So let's get some questions going. In the chat, you can type them in the chat. Let's see.
Nice to meet everybody. No need to be shy. Remember, you can ask us anything.
Let's okay. Let's see. Well, let's go ahead. Let me kind of get it started, Jim.
Sure.
Specifically on your patient rising program, uh, with the let's health insurance and getting set up with the Social Security disability is a big issue, and many with Social Security disability, many are denied. Now, MSA is on the list, compassionate list. So, how does one, when they are denied, how does one um, go about getting that insurance?
That's a really good question, a really important one. We all know that anyone who's ever tried to apply for disability knows how complicated it can be, and that doing it alone is unwise. You need guidance. So there are firms, and in fact, Patients Rising Concierge has a partnership with a law firm called Evans Disability, who specialize in getting people on to Social Security disability insurance or supplementary security income. So because it's so complicated, we know that we can't handle it in a single phone call. So we have formed a partnership with experts in the field. Another thing that I recommend to anyone who's having trouble getting access to insurance is to actually go to healthcare.gov. It's a powerful tool for finding out what kind of insurance what you qualify for, and that could include disability coverage. So in the screening process at healthcare.gov, you can find out what's available in your state as far as Medicaid, or what criteria you need to meet. And if you meet them, because they'll ask it's rather an exhausting process. It doesn't force you to make a decision at the end. You don't have to buy insurance before you leave or anything, but it's a great way of finding out what you would qualify for based on your household income, your age, veteran status, all kinds of factors. So because those things are so complicated, we point people in those directions because those resources have reliably been able to help people. And that's our philosophy. If we can't answer your question for you, we're going out there and finding the experts who can and making relationships with them.
And that's very important. Another question I have, in regards to, we'll jump up to relationships. Many times it's difficult to talk to families do you have, with your program, do you actually speak with families to help them understand the disease, or do you have outsources that can help?
Well, there are plenty of places that a family can go to have this kind of conversation facilitated. And interestingly enough, different organizations for different diseases, from my own experience, I'll speak about the Alzheimer's Association. They have forums where family members can come together and have their conversation privately, but sort of moderated by someone at alz.org. This is good because oftentimes when a family has to have the hard conversation about someone's future, caregiving, cost, anything like that, the reason it's hard is because there's a lifetime of expectations built up in what those relationships are supposed to look like. I had a very hard time talking with my mom about taking over some of my father's caregiving duties. She was very resistant, and oftentimes we would start the conversation and it wouldn't go more than a few minutes before it was clear that the energy was kind of getting toxic fast, and people were feeling defensive, protective, attacked. So it's really hard. I'd suggest for anybody having this conversation to try doing it in a neutral location where the rhetorical power of the household is not necessarily present, because it's going to tip the ability to have a fair conversation. We don't have one resource for that, but what we do is we find group therapy practices, which are sometimes really necessary for these hard conversations. Things like end-of-life conversations are, the stakes don't get much higher than that, you know. So we can find places, whether it's, you know, your local faith center may have the ability to support such a conversation, but we can find things that are local for a family, to make it more possible, or at least central for a family, because of course a lot of families are spread across the country nowadays. So we can find a way to facilitate those conversations. If you contact us, we'll get a resource for you for sure.
Okay, thank you. And your information will be on your site. Yes.
Yes, for sure.
Okay. Let's see.
I can hold up a card, but I don't know how visible it'll be.
Well, I looked at your website. I looked at your website this morning, and it's very good. So much information that's so very helpful. And, you know, knowledge is so important. Like you say, it empowers us, but it also gives us the power to be in control as much as we can. And I think that's so important. I think when we don't have that, we may not do as well. And I think that's very important. Let me see. I have a question here. You help us get access to the medicine or treatment.
Oh, okay. That's a fair question. No, we don't, but we know who does. So we can connect you with places like Needy Meds, who we have a partnership with, or Good RX. These are places where you can get affordable access to medications. You know, they have some rules. Certain types of insurance, you can't use a company like, or a service like Good RX or Needy Meds, but most people can. Of course, that's trying to make medications affordable, but the gateway to getting the medications you need are, of course, a doctor who's prepared to write you a prescription. But I don't think that was the nature of your question. Although I like to remind folks that's that's the real reason it's important to have a good relationship with your doctor, because no doctor, no treatments. That's the way healthcare works. So it's worth it to invest in having a good understanding of what your needs are with your physician.
Thank you.
Kathy, I saw a couple of questions,
Another,
and yeah.
yeah, we've got another question here from the audience. Many MSA patients need help at home, but can't afford to pay out of pocket. Any ideas?
Yeah, for sure. Many states now have programs that will pay families, pay a family member to be a caregiver for a family member. So even though my mother at the time didn't qualify for it, she could have been paid to be my father's caregiver. This is a great way to bring costs down in a household. So I would say you can either contact us and we can research what the situation is in your state, or you can search that for yourself, getting paid as a caregiver in your state. It's a quick search, and you should find whether your state has a resource for that or not. And if they don't, there are other programs that can help. There are not just respite programs to give a break to caregivers, but also like micro grants that can help cover certain types of costs, like medical equipment costs. And there are even programs, I believe, at many stores. You should go to if you have a place that you tend to shop a lot, go and see if they have discounts for medical equipment or medical supplies, or the kinds of supplies that you need at home to care for a loved one or for yourself. But yeah, those home costs they add up very quickly. Places like the Patient Advocate Foundation and the Patient Access Network, they have really good, complex systems for providing grants to individuals and families based on their financial need. So in the presentation, I mentioned that, like at Patients Rising Concierge, we don't ask about income or anything like that. But some of the other services like PAN and PAF that do, they do that because they can tap into government money that can help support someone if their household income is below a certain amount. There are also programs through the VA to help support at-home caregiving costs if you're a veteran or caring for one. And it's also worth it to investigate with your life insurance, because believe it or not, life insurance policies are invested in keeping you alive. So they may actually have programs that can help offset some costs for you. So there are definitely some resources to check out. Because every person is unique, I can give you some general ideas here, but if you contact us at the concierge program, we can figure out what's available to you based on your location, your age, veteran status, all of that.
Okay, great. Okay, well, next question. Some research we found out may have promise for us, such as the stem cell study or some drugs. If we're not a participant in the study, can you help us get access to the medicine or treatment?
Well, the simple answer is no. And that's because, again, the gatekeeper of treatments is always going to be a physician. But there is something called compassionate use, or expanded access. Okay. Now, I'll give you an example of how this has worked. Gastroparesis patients, patients who have motility problems in their digestive system.
Mhm.
There's a drug that was available for many years to treat it, and then the FDA took it off the market. But because it was an effective medication and it hasn't been replaced by another one, the FDA also set up an expanded access protocol. What this means is a doctor can essentially create a one-person clinical trial. So can get you access to the treatment that you need, but there's a lot of paperwork involved and stuff, which is not your problem. That's your doctor's issue. But so they can give you access to treatments that might not otherwise be available over the counter or even by prescription. It just involves them getting something from the FDA called an investigational new device registration, an IND number, so that each provider patient interaction with this off-label treatment, which is what you would call any treatment that's not FDA approved for a given disease, can be tracked and conducted safely. And in some cases, we help doctors' offices with the paperwork to make expanded access possible. So anyone can talk to their doctor about getting access or getting expanded access or compassionate access to treatments that are otherwise not available to you over the counter or by prescription.
Okay, thank you.
Sure.
Next question. I am a teacher in the school district that pays for my disability. D, till next year, they also pay for my insurance. Will I be able to go on Social Security disability when my disability ends in July?
I'm sorry, but I don't know. But I could research this and get back to you. So I actually recommend you contact us at our 800 number or use our email, ask us anything, and our researchers can get on this. So we have several people who are essentially researching questions like this. I think the basic answer is yes, but we need to find out how to do it. All right. It could involve just going through the Social Security Administration, but that can be very slow and cumbersome. So I'm sure there are services that can help you make that transition. We just need to find out what's available in your state, for instance. So please do contact us at Ask Us Anything or use our phone number, the 800-685-2654 number, and we'll gladly help look up what's specific for your situation. Okay. Anyone can do that. We're happy to help anyone.
Okay. All righty. Well, this concludes our question and answer. And I want to say again, Jim, thank you so very much for being a part of our conference and bringing this information to us and giving us a path to contact you and get further information and help navigate us on this journey. And thank you to the audience. It was good to spend some time with all of you, and thank you so much.
Thank you. It's been a real honor being here, and I hope to have some conversations with several of you, learn more about MSA, and help you get the answers you need. Thank you so much.
Well, thank you. Thank you.